Hey folks, I'm Howard Lux.
I'm Jeff Berg.
We are two boneheads. We're orthopedic surgeons with 40 years of experience. We're trying to bring to you on a weekly basis. This talk is going to be on a certain type of meniscus tear. Now, the meniscus is a cartilage disc in the knee. We actually have two of them, one on the inner or the medial side, one on the outer or lateral side. We've heard a lot of stories about degenerative meniscus tears where it's just wearing out and the fact that most of those don't need surgery. Well, there's two specific types that do tend to need surgery. One is a bucket handle tear and one is a flap tear. Dr. Berg.
Yeah, so flap tears. So flap tears, the thing to think about a meniscus, it's a little C-shaped disc in your knee, and it's usually smooth. But if it tears and a little piece flips off, that little piece will flip around your knee. Just like maybe having a hair in your eye or a piece of corn between your teeth, it starts to irritate the local tissues, causing pain. Sometimes the local tissues will produce fluid. You get some pressure in your knee and more pain. And these tend not to heal well. They're on an area of the knee where there's not a great blood supply. And the only thing you can do to make these better is you can rest it, maybe take some anti-inflammatories and reduce the inflammation, and your symptoms go away for a little bit of period of time. But if you're active and start moving around again, these are going to hurt you. And so we go in and we clip these out. Howard, tell them how we do that.
Well, that's called an arthroscopy. We put these two small 1/4-inch holes on your knee, and in the front of your knee, we put a camera through one, and we have a multitude of instruments to try and reach that little flap tear that might be bothering you, and it's usually in the back on the inner side of your knee. Usually a very quick operation, and if we don't touch too many other tissues in your knee, you generally do really well, really quickly. Now, we're starting to see, we see a lot of kids with who sustain an injury, and they twist their knee, something pops, and now they can't straighten their knee. Why can't they straighten their knee?
Yeah, well, so it's a little different than the other tear in that these tears are much bigger tear. And as Howard alluded to, they often come with an injury. And what happens is instead of the meniscus getting a little flap in it that's just an irritant, that whole meniscus or a good chunk of that meniscus pulls off its outer connection and it flips over. We call it a bucket handle tear because it's like a bucket handle. It flips back and forth. But sometimes these get jammed in the front. And just like the wedge on a door you're trying to keep open, you can't straighten your knee. Really painful problem. Right, Howard?
Absolutely. Children are miserable, and they'll never get back their full extension or ability to completely straighten the knee. These tears, now, they're not a surgical emergency, but you certainly want to get to them early. The earlier that we can get to them, the easier it is to fix them, the better chance it's going to heal, and the less chance that the meniscus is going to change its shape or become degenerative.
Yeah, so unlike the flap tear, where really our only option is to trim it out, in these bucket handle tears, we want to repair these, right? So we want to try, whenever we're doing meniscal surgery, we want to try to save as much meniscus as we can. That's the best thing. In some cases, we can't save it. It's not going to heal. We put sutures in it. It's going to tear like the flap tear we talked about. But in these bucket handle tears, we can put stitches back and we can get these things to heal. That's the best thing. And as Howard mentioned, if we wait too long and the meniscus gets deformed or tears in a bunch of different directions, it can make that very difficult, if not impossible. And then Howard, what happens if you have to remove this large piece of meniscus?
If you lose a lot of your meniscus, the risk is developing osteoarthritis. And if this tear occurs in a teenager, that arthritis is going to start at a very young age.
That's a big problem.
It is a very big problem. So you've heard a lot about degenerative meniscus tears in recent news pieces and in the New York Times and other magazines. The flap tears and the bucket handle tears are two very different tears that produce mechanical symptoms. You can't straighten the knee. The knee feels like it's going to lock or pop. These generally do require surgery, and if they're caught early enough, we can usually fix the bucket handle tears, and you do very well. Have a great day.
Have a nice day.